Hi, welcome to my video. In this video, we'll be looking at cognition and perception in stroke. First and foremost, I would love to identify or define perception and cognition one by one. What is cognition? Cognition is a mental action or process of acquiring knowledge and understanding through experience, thoughts, and senses. What is perception? Perception is nothing but the ability to see, hear, and being aware of what is happening in the senses. Now, looking at cognition and perception in stroke, these are the most hampered conditions or dysfunction, mostly in the hemiplegic patient. Let's talk about cognition. Cognition, for it being an action of understanding and acquiring knowledge, in most of the case, the patient is unable to recognize, mostly even where they are, the place. They cannot know the orientation because of cognition affection. They cannot understand. Even if you ask them what is happening around you, they cannot understand because the cognition or the ability to understand or acquire knowledge is affected. The patient with acute stroke may largely become also unaware of certain things. They have hampering of maybe attention, memory is affected, and patient may completely just being confused. And most of the time, this is due to the lesion in the cortex. This may affect person's orientation, alertness, memory, and executive function. In most of the cases, it is being determined on which part of the body or the area being affected. But during examination of cognition, in majority of the cases, we usually acquire the information from the people, maybe the caregivers, the family, and etc., the people who are available, who knows much about the patient. Now, quickly, let us look at the perception, which is just the ability to hear and see, and also being aware of what is happening around you, and also through the senses. So now we are going to look at this perception in stroke. You see, it is frequently as a result of a lesion in the right parietal cortex. When there's a lesion in the right parietal cortex, this is when you can see mostly with more in the hemiplegic patient, as I said earlier. It usually affects the body scheme, the image of the body. It is being affected, it is being altered. You find a person with unilateral neglect, whereby they have one side, maybe the visual perspective is one side, they cannot orient the other side of the body, they cannot really see. Okay, sometimes you can tell them they could have repetitive words because they don't even, they are not even aware of what is happening around. So this is about perception dysfunction as well as cognition dysfunction in the patients of stroke. So thank you for watching my video. I want to say thank you. Maybe it really helped you in one way or the other. Thank you so much. And the reference is in the Sullivan. You can refer to the Sullivan once more. Page 176. It is there from page 143. Going down, you will find this content. Thank you so much.